Nursing is the profession that spends the most time with patients in healthcare at any given time. So I'm gonna be directing my informative conversation to nurses. So I want to just say that nurses are awesome. I love working alongside them, and there is so many really good ones out there that I've met. So you guys keep doing what you do. We appreciate it every day. With that said, I just wanted to discuss with you um, on some ways to better treat uh, patients that may come across in any hospital for to seek treatment. We're gonna have different populations. Let's say like um, races, different cultures, um, different sexes, like let's say men or women. So I just wanted to talk to you about the differences between sex and gender. So sex refers to the hormonal and anatomical differences between men and women and their biological characteristics. Um, we are either identified as female or male based upon the reproductive functions. Um, and gender refers to the differences between men and women as defined by culture. It is a socially constructed definition of men and women, and it is determined by the tasks, functions, roles attributed to women and men in society and in public and private life. Um, let's say in some cultures, men are perceived to be the breadwinners of the family. A man is um, a man is supposed to wake up every day and go to work and provide for their family, and females are not allowed to work. Their work is to stay at home and take care of all household tasks alongside raising children. So, yeah, the, just different tasks for men and women. Um, and then there is also gender inequalities when it comes to working too. In like let's say in countries like the United States where um, it doesn't matter if you're male or female, you can be anything that you want in the world. But with that said, some jobs, uh, men are paid more than women, even when they're performing the same job and they came into that job at the same time. Some men are just getting paid more. So there's always going to be gender inequalities there. Um, so let's go to the biological level. Um, uh, let's let's look at everything at a biological level. Um, Males and females are determined by the, either the presence or the absence of the Y chromosomes. If there's a presence of a Y chromosome, then that determines a person to be male, and if there's a absence of a Y chromosome, then a person is determined to be female. Um, so um, on also with the whole reproductive functions, um, a woman has the uterus, the ovaries, and their outside genitalia, which is the vagina, and then the male have the testes, which produces sperm, and their outside genitalia is the penis. Um, and then behaviorally, men are more physically aggressive than women are, but they're like most men are more aggressive towards their same sex as women are to theirs. Um, Women are more sympathetic than men are, and also men tend to be more um, sexually jealous than women are. With that said, um, a law was put in place to help provide equal health care for um, people, male or females, who identify outside of their sex. Let's say, and this population of people are called, let's say, transgender. A female transitioning into a male, or a male transitioning into female. The law states that um, they these transgenders should not be denied care because of their or what they identify as. If it's a man transitioning into a woman, then they should be allowed to get, let's say, a prostate test. And if it's a man transitioning into a woman, they should be able to get like a pap smear test. There should be no discrimination about that. And also, when a patient is admitted, a hospital needs to provide uh, an electronic medical record stating stating a patient's preferred name, their assigned gender at birth, the gender that identify with, or and then a pronoun preference, like if they want to be called a she or he, that should be provided in there. So for nurses to better deal with the transgender population, there should be training for the nurses um, at, at any level, so that we can provide the best care for this group of patients and make them feel like they belong and not being discriminated against because of what they identify with. Um, so we need to educate each other and understand um, their gender identity. Um, so so that we don't make them feel singled out or judged by their choices or their gender identity. That way, both men and women, um, whether they're transgender or not, should not be afraid to seek help, to seek medical help if they need it. So, and to do this, we need to understand that there's a difference between females and males, and how medication is and and how a medication is absorbed differently between the two sexes. Let's say um, for females it takes longer to digest liquids and solids, so they stay in their stomach longer than men. That's why we tend to be have more fat than men do. So so you awesome nurses out there need to know and understand the differences in how medications are absorbed in different sexes to better treat the transgender population. Thank you.